Good day everyone! In this video, I will be performing the head-to-toe assessment. But before that, I should first verify the identity of my client to ensure nurse-to-client relationship and for me to determine my client's overall functioning to make a professional clinical judgment. Right after, I would provide privacy and explain the procedure that needs to be done. And then, I will then proceed to what we call as the objective data or the physical assessment. Before any procedure that we make, we should always wash our hands to prevent the risk of cross-contamination. Gather the needed equipment as well to ensure convenience, accessibility, and time saving. Good day, ma'am. I am Rhona Gumboc and I am your nurse for today. And you are?
Gumboc.
Okay, so Miss Gumboc, how would you like me to call you?
Mel.
Okay, so Miss Mel, how was your great day so far, rather?
I'm good.
Okay, so for me to be able to assess you, we may have to do the procedure what we call the head-to-toe assessment. So most of the examination, you will not feel the pain, but mostly you might feel uncomfortable because I will assess you from your head to toe. So if you feel or elicit any pain, just let me know immediately, okay?
Okay.
Okay, so may I please verify your identity? May I please look at your band? Okay, so may I ask you, what is your full name again?
Gumboc.
Date of birth?
February 7, 1969.
Okay, so where are we right now?
In the hospital.
And what are we going to do?
Head-to-toe assessment.
Okay, great. So, are you wearing any jewelries?
No.
Okay, so before I will proceed, is there anything else that you would like me to do?
Nothing.
Okay, thank you so much for your cooperation and just wait for a minute. I'll be back, okay?
Okay.
Okay, thank you. I would apply gloves to protect against infectious agents, especially if there are lesions. So we will assess first the skin, hair, and nails. So now I will assess my client's skin. If possible, I would expose the skin to the sunlight because sunlight is best for inspecting the skin. So ma'am, is it okay with you that I will assess your skin?
Okay.
Can I please look at your other hand? Okay, great. Next is I would also palpate the skin to assess any tenderness, its temperature, or even what we call as the edema. The client has a good skin turgor and the skin's temperature is within normal limit. I would also pinch the skin to make sure that the client rather is hydrated. Is it okay with you, ma'am, that I would pinch your skin?
Okay. Okay, thank you.
So for the nails, I would do the blanch test. So normally, the nail would regain its pink appearance after 2 seconds or less. After losing the color, the blanch nail normally regains a pink appearance within 2 seconds or less. Failure to do so suggests impaired blood flow to the extremity. Next, I would do what we call as the Shamrat window test. So ma'am, is it okay with you to put your nails together like this to see a diamond-shaped space on your cuticle? Okay, great, thank you. Next, I will do what we call as the light transmission test. Okay, thank you, ma'am. For the scalp and hair, I would check for any lesions, texture, its color, and any parasite infestation or what we know as the pediculosis. Ma'am, may I ask you to remove your accessory on the hair and your eyeglasses? Is that okay with you?
Okay.
Is it okay with you to touch your hair?
Okay.
The client's hair is silky, thick, and evenly distributed and has a variable amount of body hair. There are also no signs of infection and infestation observed. The head of the client is rounded, normocephalic, and symmetrical. So now, ma'am, I will inspect your face. So may I please ask you to smile? Okay, to frown? Okay, great. I want you to show your teeth, please. Smile and show your teeth. Okay, great. Now blow your cheeks. Okay, so raise your eyebrows. Okay, and then close your eyes. So this is done to test your cranial nerve 7, or what we know as the facial nerve. Right after, I will palpate what we call the temporal artery. It should be elastic and non-tender. So ma'am, is it okay with you that I may have to touch your face to palpate your temporal? Okay. Next would be the cranial nerve 5, or what we call as the trigeminal nerve, which is useful for mastification, or what we call as the chewing. So ma'am, may I please ask you to clench your teeth, or... Okay, great. Now I want you to open your mouth against resistance. Okay, close. So now I will also palpate for the TMJ, or what we call as the temporomandibular joint. So ma'am, may I please ask you to, for a while, may I please ask you to open? Okay, close. Open. Close. Okay, thank you. So now, ma'am, I'm going to take a peek into your eye. So may I please ask you, is your vision clear right now?
A little blurry.
Okay, so now I'm going to pull down your eyelid. Is that okay with you?
Okay.
Okay. May you please look up? Look down? Okay. So now, ma'am, I want you to look at this pen and just follow the pen, not with your head. So your head should stay still and your eyes will only move, okay?
Okay.
Okay. The patient's eye move in concert. The upper lid covers upper portion of cornea when the patient is looking straight. So right now, I want to make sure that your pupils will be doing what they should be doing. So I have this pen right here and I'm gonna flush this into your eyes twice. Is that okay with you?
Okay.
Okay. So I can say that the patient's pupil is perla, or what we call as the pupil is equally round and reactive to light accommodation. I would also do the Snellen chart to test the visual acuity, especially the cranial nerve 2. So may I please ask you, ma'am, to read the letters, the first one?
E,
Okay.
F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
Okay, really so I can say that the patient, when standing 20 feet away, can view or read the letters the same as another person standing in 30 feet away. And right now, I will assess the peripheral visual field. So ma'am, I will close your other eye using this paper and I want you to read the numbers that I will be pointing. Is that okay with you?
Okay.
Okay. Okay, read this number.
1,
How about this?
1,
How about this?
2,
How about this?
2, 2, 2,
Okay. The other eye?
1, 1, 2, 2, 1, 1.
Okay, thank you. Next, Miss Mel, I will now assess your ears. So, do you wear any hearing aids?
No.
Okay, so is it okay with you that I will touch your ears?
Okay.
Okay. The auricles are symmetrical and has the same color with the client's facial skin. It is also aligned with the outer canthus of the eye. The pinna recoils when folded. So now I will palpate for the mastoid process. So normally this shouldn't be swollen and non-painful. So ma'am, if you feel any pain, just let me know immediately, okay?
Okay.
I'm going to palpate your mastoid process. Do you feel any pain?
No.
Okay. Now I will be performing the whisper test. So Miss Mel, I will be doing the whisper test, and what I want you to do is cover the ears you think that you cannot hear the most. Okay?
Okay.
And then right after, I want you to repeat what I will be saying.
Okay.
Okay, so cover now the ears.
Popcorn. Popcorn. Football. Football. Okay.
Now I want you to cover the other ear. Okay, great.
Popcorn. Popcorn. Football. Football. Okay.
So now I will be performing the Weber's test. So ma'am, I will be putting this tuning fork onto the center of your head and just describe to me what the sound is, okay?
Okay.
Just for a while. Do you hear the sound?
Vibrating sound.
Do you hear it equally?
Yes.
Okay. So for the Renee's test, ma'am, I will be putting this tuning fork near your ear and just tell me when you can no longer hear the sound, okay?
Okay.
Okay.
I can hear.
How about that? You cannot hear it anymore?
I can no longer hear.
How about this?
I can hear.
You can no longer hear now?
I can no longer hear.
Okay. So for the Romberg's test, ma'am, may I please ask you to stand up? Okay. Feet together. Arms at the side. Okay. Close your eyes. Okay, now open your eyes. Okay, thank you. You may now sit down. So now, ma'am, I'm going to take a look at your nose to check for symmetry. Is that okay with you?
Okay.
Okay.
The patient's nose appeared to be symmetric, straight, and uniform in color. There was no presence of discharge or flaring.
Do you have any runny nose or do you feel any stuffiness at your nose?
No.
Okay, what I want you to do is cover your nose. Only one side. Okay, breathe in. Breathe out. Okay. Now cover the other nose. Okay, breathe in. Breathe out. Okay. So now I will be checking the inside of your nose. So what I want you to do is look up. Hands up. Okay. Okay, so to test your cranial nerve 1, what I want you to do is to sniff or smell what I will be giving you and just tell me what do you smell, okay?
Okay.
Okay, close your eyes. What do you smell?
Vanilla.
Okay, great. How about this?
Vinegar.
Okay. How about this?
Coffee.
Okay, great. So now we'll be palpating your sinuses and just tell me if you feel any pain, okay?
Okay.
In your maxillary, do you feel
No.
any pain? Okay. How about your frontal?
No.
Okay, great. Do you wear any dentures, ma'am?
Yes.
Is it upper, lower, or both?
Upper.
Okay, so what I want you to do is open your mouth. I will be checking your inner mouth. Is that okay?
Okay.
The lips of the client is uniformly pink, moist, symmetric. There are no discoloration of the enamels, no retraction of the gums. The buccal mucosa of the client appeared as moist, soft, glistening, and with elastic texture. The tongue of the client is centrally positioned.
Cranial nerve 12 or the hypoglossal nerve, what I want you to do is take out your tongue. Okay, move it side to side. Okay, thank you. So now we'll use this tongue depressor to look at the inside of your mouth. Is that okay with you?
Okay.
Okay, so open your mouth, please. Okay, lift your tongue. So for the cranial nerve 9, what I want you to do is open your mouth again and say ah, okay?
Okay.
Open your mouth. Say ah.
Ah.
Okay. So you already verified that you don't have any allergies. So I will be giving you foods and just identify what foods I will be giving. Is that okay?
Okay.
Okay, please close your eyes.
Vinegar.
Okay.
Soy sauce.
Okay.
Salt.
Okay.
The client showed coordinated smooth head movement with no discomfort. The thyroid gland is not visible on inspection.
For the neck, I will assess your cranial nerve 11 or the accessory nerve. So Miss Mel, can you please move your head from side to side?
Okay.
Up and down. Okay. Now, shrug your shoulder against resistance. Okay, shrug it. Up. Okay. Now, I'll palpate your neck and just tell me if you feel any discomfort, okay?
Okay.
Now, I'll palpate for the lymph node. So, normally, it should not be palpable, but I will feel like very small beads. So, ma'am, just tell me if you elicit any pain, okay?
Okay.
Preauricular, posterior auricular, occipital, parotid, tonsillar, superficial cervical, submental, submandibular, deep cervical, posterior cervical, supraclavicular.
I will palpate for your trachea. This might be slightly uncomfortable and just let me know if you feel any pain, okay?
Okay.
Look up. Okay, breathe in. Breathe out. Okay. I will assess your thyroid gland anteriorly, so just tell me if you feel any pain, okay?
Okay.
Okay, now posteriorly. Okay, what I want you to do is drink a water right here. Okay, wait for my signal. Okay, drink water. And then swallow. Okay. Thank you. Now we'll palpate for your carotid artery. We'll also do an auscultation. Okay. So, Miss Mel, before I would check your upper extremities, may I please ask, have you had any dialysis or surgery?
No.
Okay, great. So, may I please ask you to stand? Okay, right now, to test your cranial nerve 11, may I please ask you to shrug your shoulder? Okay. Now, shrug your shoulder against resistance. Okay. Now, ma'am, I want you to put your arm like this. Okay. Then put pressure on it. Okay. Now, I want you to grasp my finger. Okay. I will palpate your brachial artery and also your radial artery. Is it okay for me to touch you?
Okay.
Okay. I will feel any lumps if there is any. How about the other hand?
Upper extremities is warm, pink, symmetrical in size, no lesions, no edema, no presence of deformities, normal hair growth, joints can be easily moved, Capillary refill is less than 2 seconds bilaterally.
Now, ma'am, I'm also going to check your reflexes. What I want you to do is just relax your arm, okay?
When tapped, the patient is able to respond with a reflex hammer. Likely, it is 2 plus with a break response.
So please close your eyes, ma'am. Do you feel it?
Yes.
How about this?
Yes.
Okay. How about this?
Yes.
Okay, for a while. How about this?
Yes.
The patient is able to feel the light touch of the object. For the tactile sensation, patient is able to identify areas stimulated by the brush.
So I will be grasping your fingers, and what I want you to do is close your eyes and identify the finger that I am grasping. So how about now?
Middle.
Okay. How about this?
Index.
Okay. So right now, I want you to identify the number that I will be writing on your palm.
3, 4.
Okay. For assessing your thorax, may I please ask, have you been experiencing cough right now? Like specifically right now?
Nothing.
Okay, so for me to be able to assess your thorax and the lungs, it might need you to take off your clothes, and I might be touching some parts of the posterior and anterior thorax. Is that okay with you?
Okay.
So thorax, by the way, it just means the chest areas. Let's assess first your posterior thorax, and what I want you to do is please face backward. Is that okay with you? Okay, so kindly please breathe. Inhale, exhale. Inhale, exhale. Inhale, exhale. I will be palpating your posterior thorax. Is that okay with you that I will touch your back?
Okay.
Okay. Just tell me if you elicit any pain.
Thorax expands symmetrical without retractions or bulging. Bilateral tactile frematus decreases below T5 posteriorly. Percussion resonant throughout. Diaphragmatic excursion is 4 cm and equal bilaterally. For auscultation, vesicular breath sounds heard in all lung fields, no adventitious sounds, no whispered, bacterioloquy, bronchophony, or egophony noted.
I will now assess your breast, but it might need me to touch some parts of her breast to palpate. Is that okay with you, ma'am?
Okay.
Okay, so I just want you to follow any directions that I will be giving. So kindly please stand up. Okay, put your arms on the side. Okay, put your arms over the head at the back. Okay, now I want you to move forward. Okay, move forward more. Okay, you may now put your arms back. Okay, now sit down. Palpate for any masses, for any lumps. May I ask you to please lie down? Is it okay with you? So, are you comfortable with that? Okay. So when I palpate your breast, just tell me if you elicit any pain or any tenderness that you might feel or any uncomfortableness. Just address it immediately, okay?
Okay.
Breast is pendulous and symmetric. Skin is dark brown with black or brown areola. No masses, thickening, tenderness, or lymphadenopathy noted. Nipples inverted bilaterally. No dimpling or retraction noted bilaterally. Free movement in all positions. And no discharge expressed.
So I will also be palpating your axillary, or what we call as the armpit. So if you feel any pain, just let me know immediately, or any masses as what I've said a while ago, okay?
Okay.
So is it okay with you that I will touch your armpit?
Okay.
The lymph nodes are non-palpable and the patient does not elicit any pain when the lymph nodes are palpated.
I will now listen to your chest, and I just want you to relax and breathe normally. So as I was inspecting to your chest, there is no protruding present and the barrel chest is not visible. So now I will palpate it. Just tell me if you elicit any pain, okay?
Okay.
So I will now also auscultate to your heart sound. So did you had any surgery prior to this examination, your heart surgery or any surgery related to the heart?
None of them.
Okay.
Heart rate is regular and rhythm with S1 and S2. No extra heart sounds such as S3 and S4. No murmurs, gallops, splitting, clicks, or snaps.
Now I will look at and listen to your abdomen or your belly. So before that, it might need me to undress you a bit into your abdominal area. So is that okay with you?
Okay.
Okay, so but before that, I want you to lie down first into the bed. Is that okay?
Okay.
For the abdomen, instead of the IPPA, we will use the IAPP so that we could not obstruct any bowel sound when we auscultate the abdomen.
Bowel sounds is low-pitched and gurgling. Aortic, renal, and iliac arteries are without brutes. Abdomen is tympanic. Area of dullness over spleen at 9th intercostal space in left post-axillary line. No friction rubs over liver or spleen.
So now, ma'am, I will also percuss or do a tapping motion onto your abdominal area. So just tell me if you elicit any pain, okay?
Okay.
Okay, so I will also palpate your abdominal area. So again, if you elicit any pain, just tell me immediately, okay?
Okay.
So you might feel somewhat uncomfortable since I will be palpating some parts of it. So I would also do a deep palpation. So a while ago, that was light palpation, but right now it would be deeper than what I did a while ago. Is that okay?
Okay.
So again, just tell me immediately if you feel any pain. So you might feel somewhat uncomfortable here. If the patient shows some sign of appendicitis, we could use the special maneuver, which includes the Robsing, the psoas, and the obturator sign. So to assess for the appendix, we will first palpate the right lower quadrant. So here is the right lower quadrant of the patient. Do you feel any pain, ma'am?
No.
What I want you to do is lift your leg against resistance. Is that okay? Okay, your right leg. Lift your leg. Okay. Do you feel any pain?
No.
Okay. Now, ma'am, what I want you to do is face sideways or move your body sideways. Is that okay? Okay. Got that? You feel comfortable? So now what I want you to do is lift your leg. Okay, now flex it. Do you feel any pain?
No.
Okay, for a while, I will drape you first properly. So again, up, and then flex it. Okay. Okay, ma'am, I will be assessing your legs, feet, and toes, and your musculoskeletal. But before that, may I ask you, do you feel any pain in your legs?
No.
Did you had any leg cramps?
No.
Okay.
Symmetric in size and shape. Skin is intact and dark brown.
Palpate now your pose. So, is that comfortable, ma'am?
Okay.
Okay. How about the other leg?
No bruising without edema, lesions, or increased vascularity. Femoral pulses is 2+ and equal bilateral, without brutes. Dorsalis pedal and posterior tibial pulses 1+ and equal bilaterally.
I will do the blanch test. So it should be regaining its color in 2 seconds, at least 2 seconds. Now, ma'am, I will test your sense of touch on your plantar area or the soles of your feet. So just tell me if you don't feel any tingling, okay?
Okay.
Do you feel that? Ma'am, may I please ask you to perform the heel to chin test? So what I want you to do is put the heel of your feet here and run it downwards to your chin, okay?
Okay.
Okay, now do it, please. Put your feet and then run it to your chin. Okay. The other feet, please. Foot rather. Run it to your chin. Ma'am, I will also feel your, or rather assess your reflexes. So I just want you to be comfortable and relax, okay?
Okay.
When tapped, the patient is able to respond with the reflex hammer. Likely, it is 2+ with a brick response.
So for your musculoskeletal, what I want you to do is face backward. Okay, bend forward. Okay, bend forward. Okay, face forward again. And then bend. Okay.
For the musculoskeletal, the patient's posture is erect. Gait is steady, smooth, and coordinated with even base. Full, smooth range of motion of the cervical and the lumbar spine. Upper extremities and lower extremities are symmetric, without lesions, nodules, deformities, or swelling.
Like this, then close your eyes. Put your finger in front of you, only one, okay? And then put it back. And then the other finger, okay, put it back. Okay. So far, ma'am, we're done with our head-to-toe assessment. So may I please ask you, do you feel any pain throughout? Any uncomfortableness, or masses, tenderness? Okay, great. So before I would go, so is there anything else that you would like me to do? Okay, so thank you so much for your cooperation. I am again your nurse, Rhona si Gumboc. So before I would proceed, there is the call light just right beside you. You can call me anytime if you need any help, okay? Okay, so thank you again, ma'am, for your cooperation. So that is the head-to-toe assessment. Before anything else that we should do, we should also always explain to the client, provide privacy, wash our hands, and right after, make the client comfortable in every procedure that we make. So again, that is the head-to-toe assessment, and thank you.